Good morning, and thank you everyone for taking the time to review this training video. I know that all of you will be excited to hear about the positive changes that our hospital is putting in place for next year with regards to incentive pay. I want to start off by acknowledging all the hard work and effort that you all put in every day. It does not go unnoticed, and each and every one of you are greatly appreciated. As employees of this hospital, most of you know that we have a strong presence here in our community and that we, as an organization, have been running close to full capacity for the last few quarters. Our payer mix of commercial and reimbursable insurance contracts has increased about 10%. This is due to obtaining new contracts and referrals, and the referrals are mostly due to the high quality care that all of you provide to our patients and their families every day. Word of mouth goes a long way. You all have worked so hard to contribute to creating a positive patient experience that the hospital has decided to incorporate incentive pay bonus for hitting certain standards and targets that have been established by the hospital. Of course, there are certain eligibility requirements that have to be met. All of this will be covered in more detail in the following slides. At this point, I'm sure that all of you are curious to know what incentive pay is. Incentive pay is designed as compensation other than base wages according to employees' attainment of some standard, like a pre-established formula, individual or group goals, or company earnings. How this translates to all of you is this. The hospital has certain benchmarks and standards that have been established, some by the hospital and some by CMS, which most of you know is the Centers for Medicaid Services. If we are able to hit the benchmarks and standards, the hospital is instituting incentive bonuses that are hospital-wide, at the department level, and even at an individual level. All of you play an important role in patient satisfaction, safety, and quality, and the overall patient experience. The following slides will break down this on each level and cover what the eligibility requirements are. Okay, now we can break down these incentive plans. As far as individual incentives, the hospital is going to institute a referral bonus for hard-to-fill positions. These positions are listed here on the slide, and the corresponding bonus as well. How this works is if a qualified applicant gets hired on, and after 1 year of employment, as long as they're in good standing with the company, the referring employee will receive a one-time referral bonus for each qualified applicant they refer. The employee must be listed on the applicant's initial application for employment to be considered for the bonus, in addition to other eligibility requirements that will be discussed later in this training video. For the successful hiring of nurses, registered nurses, the bonus will be $1,200. For physicians, it will be $1,500. Pharmacists will be $1,000, and physical therapists will be $750. The next topic is bonus pay. When the hospital is short-staffed and employees volunteer to come in and work on their day off, they will be granted bonus pay, which consists of an extra $10 an hour on top of base rate and any overtime pay for nurses, and an extra $5 an hour for nursing assistants. Please keep in mind that this initiative is trying to prevent nurses and nursing assistants from working short. And when we go through surge, where we have a lot of patients being admitted and not enough nurses, we're hoping that this incentive will bring extra people into work when they normally wouldn't. As usual, we will continue to be offering merit increases based on your annual performance appraisal evaluations. If the targets are met, the merit increases will be increased by 0.5% or for each tier than the previous years. For example, if you scored really high and your merit increase was supposed to be 3%, next year it will be 3.5%, and so forth. Group incentive plans. In addition to individual incentives that we just discussed, there's an opportunity for departments to receive incentives on a group level. The departments that hit the hospital's safety goals will receive a bonus of 1 day off with pay to be used in the following 12 months, excluding holidays. The safety targets are 0 patient falls with injury, 0 catheter-associated UTIs, which are urinary tract infections, and 0 hospital-acquired pressure ulcers for the calendar year. The departments that have more than 20 employees, who have 85 to 99% participation in the annual safety survey, each employee in that department will receive a voucher for a free lunch in the hospital cafeteria. Those departments that can reach 100% participation will also receive the lunch voucher, but in addition will receive 4 hours of PTO, or paid time off, to be added to their PTO bank. Obviously, this initiative is to encourage participation in this annual safety survey. That is not only important to the hospital, but should be important to each and every one of you. It's an opportunity to have your voices heard and to report things that you feel are unsafe, and gives us an opportunity to rectify that. Another group level incentive is that the top performing inpatient unit that receives the highest patient satisfaction scores over the course of a year, each employee from that department will receive a full day off with pay to be used sometime during the next year. Now, since the ICUs are such small departments, they will be grouped together in order to make this initiative more fair to the rest of the hospital. The next topic of discussion is hospital-wide incentives. If the patient satisfaction scores hospital-wide are at or above the benchmark for the year, then everyone in the hospital, regardless of what department you work in, whether it be housekeeping, dietary, nursing, pharmacy, will all receive a 1% bonus. The bonus is 1% of your annual salary. However, there are some employees that are exempt. They include members of the A team or the administrative team and some of the department directors, which they are already well aware of this. As you all know, safety and quality are huge initiatives that the hospital prides itself on. If the hospital is able to maintain an A grade from Leapfrog for the year, all patient care area employees will receive a 0.5% bonus of their annual salary. Fortunately, we have been successful in maintaining an A grade from Leapfrog for the past 3 years, and the hospital wants to be able to maintain this standard. That is why they put forth this initiative to encourage you all to continue on with the best care that you guys have been providing so far. Okay, here come the nuts and bolts of this. The eligibility requirements. In order to be qualified for any of the incentives we mentioned, except for the free lunch vouchers, employees must have been employed with the company a minimum of 1 year and be in good standing. To be in good standing with the company means that you have no performance or disciplinary issues in the last 12 months. This does not include informal counseling that's done on the unit level. It more pertains to documented verbal conversations and documented performance managements that are in your employee file. If you have any questions regarding that, most of you know if you're an active performance management discipline and you already know who you are. In addition, in order to be eligible for the incentives, there cannot be an excessive amount of attendance issues. This breaks down into no more than 4 occurrences in a quarter. If you don't know already, an occurrence is each day you call in sick, or if you have 2 tardies. 2 tardies will equal 1 occurrence in a quarter. Okay, I think that about wraps it up. If you have any questions at all, please feel free to reach out to me or any of the staff in our HR department with any questions or concerns you may have. Of course, there will be more information coming out to you all via US mail and work email, and we will hold informational mini meetings that will be held in the hospital cafeteria in the coming weeks and when the rollout date is getting closer. The mini meetings will give you an opportunity to ask the HR staff questions, and they will be able to provide you with flyers and leaflets that include the information that was covered in today's session. I look forward to hearing from each and every one of you, and thank you for your time and attention, and thank you all for the high quality care that you continue to provide our patients and families every day.